Thanks. First of all, I want to thank Dan for inviting me here today. The Alliance for Aging Research has done a lot for the aging research field, and they continue to put everything they can into helping us get the resources we need in this exciting new area of research. As CEO of the Buck Institute, I'll tell you just a little bit about it. It was the first independent, nonprofit research institute dedicated to aging. We have 20 professors there who run independent research programs, and they focus either on the basic biology of aging or particular diseases of aging, for instance, cancer, Alzheimer's disease, diabetes, etc. And it's a very collaborative place. We have over 200 employees, many postdoctoral fellows doing research there. And the idea is to synergize efforts on basic biology of aging with people working on the diseases of aging to get new insights. Our goal is to extend healthspan, the healthy, functional, disease-free period of life. This report by the Alliance was compiled by a number of scientists. I was privileged to be involved in that process, and written by David Stipp, who's a wonderful writer. I think it really encapsulates not only where aging research has been the last few years, the great promise that's come from that research, where it can also go as well. There are many important directives in it, and many descriptions of vital experiments that have been performed recently. I will just highlight one of them. There now is a drug, a clinically approved drug, rapamycin, that you can give to a middle-aged mouse. The mouse lives 15% longer in response to this drug. It also has a 15% longer health span. So we already know that this concept is achievable in a mammalian animal model. I think it's reasonable to set a goal that we can extend health span similarly in humans in the not too distant future. If that were true, you would have, on average, 10 extra years of healthy life to have. And so you would, in fact, look like 60, and when you're 80, it would be the new 60. So I'm very excited to be involved in that. I think that this campaign is also vitally important. As you heard, the support for aging research is very limited, and yet it's the biggest risk factor for every chronic disease or almost every chronic disease that you heard about today. And so we need to raise public awareness and help get the resources to make this promise come true. I think that can be accomplished, and I'm very excited doing everything I can to contribute to that possibility. I believe that geroscience is an important initiative. This NIH funded or supported initiative is a vital step forward for them. Dr. Hodes at NIA is really spearheading something that will involve other institutes, and I think do what the Buck Institute has been doing for a while, look at the interface between the basic biology of aging and the diseases of aging. And so I'm also very supportive of that. Geroscience, by the way, is something, the research was started at the Buck Institute. It was a roadmap funded grant from the NIH that we've been doing over 5 years at the Buck. There's been a great number of insights that have come from that. And so we're excited to see that term get outside of the state of California. So I don't want to take too much more time. I'm happy to answer questions about rapamycin or about any of the other research. I just want to reinforce my support for the Alliance and this program that's been produced. I think it's going to be vital as we look how to go forward with aging research. And the Buck Institute will be behind this initiative 100%. Thank you.
Thank you, Brian. I just draw your attention. Thank you very much, Dr. Kennedy, for making the trip to be here today, and to Mr. Frank Carter for providing us a real-life example of aging as the new 60. So what you can tell that this is not science fiction. It's real science, as we've heard from Dr. Kennedy, and it's not beyond the bounds of being possible for many, many more of our fellow human beings to live and age like Mr. Carter, and beyond that, to avoid conditions that now threaten him, from type 2 diabetes to some other conditions, all linked to the aging process. In your materials, you will see that the Alliance is joined by many other academic institutions, from the Einstein Medical College in New York to the University of Texas, other not-for-profit organizations, certainly the Buck Institute, and others, and they are all listed in your materials. I thank you all for staying following the hearing today, very important hearing on federal funding for medical research for the years ahead. Thank you all very much.